Welcome back to See the Stories. This is the signature segment of the 3-hour news show on See Today. We are still here with Coach Ani right now. And before the break, we talked a bit about your background, which is a midwife. That is so lovely. And could you please tell us more about it and how has it helped you with this career right now as a coach?
Okay, I was started my career at the hospital as usually midwife work in a hospital or clinical background. But then I found it a little bit boring.
Okay.
And I have a background as an athlete, taekwondo athlete. So I was like, I like sport, doing workout since I was young. And then it just go like that. I'm doing fitness, gym, strength training for a while, yoga. And specifically after birth, I experienced postpartum depression, and workout and training, postnatal training has been a lot of, helped me a lot during that time, and here I am today.
Wow, that is actually awesome.
Awesome.
Does your client often, consult about the pregnancy?
That is good, exactly, right? I didn't know that you're also doing taekwondo now. That's interesting, actually, because now I kind of want to know how late or how long do you have to wait after giving birth before you start, thinking about, doing exercises?
Typically, yes. Typically, when a woman went through a vaginal delivery, they can start exercise after 6 weeks or 40 days. But if you went through C-section, of course you have to wait longer. Yeah, it's about 8 to 10 weeks after birth.
Just 8 to 10 weeks, really?
Yes.
Okay, as soon as that, because I still remember back then, even after 4 months after the C-section, I can still feel the lower abdomen numb, because of
that's right.
Oh, okay.
That's why we cannot take it easily. When we start the postnatal training, we have to start from 0 ground. No matter how advanced your fitness level before pregnancy, you have to start from 0 because it's totally different body.
Yes, that explains.
Yes.
Right. Now, I got one more now. When you're exercising, whether during the pregnancy period or after, is there a, let's say, normal, guys like us, when we're training, we want to focus on our heartbeat.
Yes.
But what about when you're training, exercising with the moms?
Yes.
What kind of baseline that you go with?
Yeah, we used to use the 140 beat per minute, the heart rate. But now, based on the recent studies, we use the talk test.
What is that?
What is the talk test? The pregnant women, we encourage the pregnant women to talk during the movement. So we as a trainer knows whether the intensity of the training is too much for her or it's good. It's already okay.
Right. That's really interesting.
That's so smart, actually.
That's why as a pre and postnatal training, we have to have an ability to talk
and engage
the conversation with the client. Unless the client will stay silent during the movement, and we don't know helpless with the condition. Yes.
Oh, so that is actually a recent study showing everybody there's actually a better way to know whether or not the participant of the exercise is actually getting maybe a little too tired or the heart rate is getting up just by talking.
Yes.
Because when you want to know the BPM, you should have some kind of device, right?
I think so, that, or you can do it manually.
Manually, but it takes time.
But that takes time. But
true.
that is really actually pretty good.
Yes.
I got an idea now.
Great. Now let's move on to the things on the table right now. You've brought so many props. We want to know what they are and what do you use it for?
Okay, this is especially to show when it goes to pregnant women, we can see the abs, the growing belly, the baby inside the uterus. But when it goes to postnatal, post-birth mothers, people think it's okay to let them just run after birth. No, it's a big no.
Yeah.
Okay.
I have a lot of clients love to do tennis. before,
Right.
even during pregnancy. But after birth, you have to wait. You cannot just see the postnatal training as a way to reduce the baby weight gain. No, you have to see the training to re-strengthen and rehabbing your core first. And this is the pelvic floor.
It forward to
yes.
show it to the camera. Yeah.
This is the pelvic floor muscle, part of your core. People think the core muscle is limited only to your abs.
Right.
No, actually it's not only the abs. It's include the diaphragm, the pelvic floor muscle, and also the abs and part of your lower back.
Okay.
And after birth, this is what we have to focus on for a couple of weeks before entering the general fitness training program.
I see. Yeah, all the muscles are integrated.
Yes.
Right? Not just the abs.
Yes.
But I noticed something after giving birth. Of course, I took a shower and then I want to, shampoo my hair and then dry my hair. I couldn't lift my
It's just as easy as that. As simple.
because it's all connected, right?
Yes,
Like you said
exactly.
earlier, the pelvic muscle, the abs, the back.
It's like the chain.
Yeah.
Right.
Oh, it's a good tool
Simple
to
moves,
explain
just going up
to
like
us.
this, it was a challenge for you.
Yes.
Imagine when you just gave birth, a lot of activity. You do like forward bend, breastfeed the baby, lifting the baby, and it makes you hunch your back too much.
Yeah.
That's why maybe you cannot lift your weight.
Well, you have to be careful. You
Easily.
got to understand that kind of movement too. Okay. What about the other that stuff too? You want to tell us?
This is to help you to see. Imagine this is your growing. Why some people experience the bulging on the belly, belly bulging after birth, because the situation is called diastasis recti. The stretch of the abs muscle, abdominal muscle during the pregnancy is actually a normal thing because of the baby has to grow, and the only way you can grow, you can give the space is by stretching the abs.
Right.
Yeah.
But after that, the abs has to go back. But not many people have that awareness.
Right.
Okay.
You're right.
One, imagine this is your abs and this is stretch.
Yeah.
Right.
It has to be back, but it's not happen to some women.
Right.
Many women, especially the ones who stay sedentary while pregnant, or maybe having multiple babies in pregnancy, or maybe having big baby, so the abs stretch too much, expand too much, and that's why you need postnatal training.
So the condition, the diastasis recti, is reversible?
Yes, reversible, but some people needs to put an effort.
True.
Right.
Yeah.
Recognizing it and then putting the effort to making sure that it's.
Yes.
Yeah, because again, personal experience, my wife is still, it's like this. I mean, it's not fully back yet.
Yeah.
So I think it's now an idea for her to kind of maybe, hopefully.
Exactly.
So not everyone, not everyone's muscle get to go back to where it used to be automatically, and that's why we need exercise.
Yeah.
And today we got the chance to learn from Coach Ani. Perhaps you can show us
some of the moves?
exercise.
Okay. Before we start the exercise, I want to share that the fundamental things in pre and postnatal training is breathing.
Breathing.
Okay.
All right.
Breathing is the fundamentals. You cannot, holding your breath is big no.
Okay.
Yeah. So I would like to share how to breathe during the movement.
Okay.
How do we sit? Just comfortably like this?
Just have a seat.
Right.
Put your arms on your hips. Lengthen the spine, shoulders down. Just inhale naturally. Exhale. Imagine your abs just like a zipper. Zip from lower abs to upper abs.
Okay.
While making a sound. Okay?
When exhale, we make a sound.
Yes.
And suck the tummy in.
Yes, zipping up.
Zip up.
Why
all right.
I don't say sucking the belly button in?
Because they're pregnant.
Yeah. Because when you suck your belly, lower belly is a skip. And
got it.
we have to activate the lower abs first before the mid and upper abs. Okay? Let's do it.
Okay.
Maybe it's kind of weird at the first time.
Yeah, because normally when you exhale, you exhale. Well, yeah, okay, let's try it.
Okay.
It's like a singing technique, right?
Yes.
When you inhale, the diaphragm expands, and then when you
Exactly.
exhale, it's...
Oh yes, like that. You're right.
Yeah.
Okay.
Okay, let's do this.
Let's do this. Okay. Hands on your hips, lengthen the spine, shoulders down. Inhale, relax your belly. And zip up your belly, exhale. Good. Repeat. Inhale. Squeeze your belly, zip, exhale. 3 more times. Inhale. Zip up your belly, exhale. Twice more.
I feel it. Okay.
Inhale. Zip from lower, exhale. One more time. Inhale. And exhale. Good job.
Yeah, I feel it. Okay. All right.
Even it will be more beneficial when you can do your Kegel, activating your pelvic floor, but
While you,
it will be too much.
why are you laughing at me?
Can men do Kegel too?
Interestingly, many men
I feel I'm being exposed now.
are not believe that they have pelvic floor. They do.
Good thing I asked.
That's
Okay.
why many lifter
Uh-huh.
experience prolapse or hernia because they don't activating the pelvic floor.
Even professional lifters don't do that.
Yes.
I feel good now.
Okay, you better start doing
I better start doing it.
Yeah.
All right, so now we got the breathing
Yes.
technique down. What about some of the movements, the staple
Okay,
movements
good.
that you probably...
So after you do the breathing correctly, now we can move with the breathing, along with the breathing.
Okay.
Yeah. Let's
we stand up,
in
okay?
stand-up position.
Okay.
Open your legs hip width apart.
Okay.
This is common movement during pre and postnatal and for general fitness. Squatting.
Oh.
Put your hands in front of your
for
chest.
pregnant women?
Yes.
Oh, okay.
Inhale, going down. Exhale, zip up your belly. Nah.
Oh, you doing this when you're
Yes.
It helps
Hats
the
off to you
baby.
guys.
Yeah.
Okay. Really?
So it's different when you performing the movement without connecting with the breathing,
Right.
and when you do the movement, connect with the breathing. Totally different.
Okay.
The effectiveness, the impact to your body is different. Let's give it a try.
Okay.
Okay?
Okay.
3 times.
Okay.
Yeah. And going down, inhale. Exhale, zip up. Good. Twice more. Inhale. Squeeze. Exhale. One more time. Inhale, hips down. Zip up. Exhale. Okay.
Wow.
Okay.
Yeah, it's
How it
different.
feels?
When we concentrate more on the breathing,
Yes.
you can really feel all the muscles activating.
Yes, exactly.
Wow. thank
I
you
mean,
for that.
still though, for a pregnant woman to be doing that, it might, for the love of me, I can't imagine. But you guys actually can do it, and this is something that
exactly.
you
And that's,
have to do.
That's what many people think.
Right.
I'm afraid when we squat, the baby will
Right, that you're gonna put
going
yourself
down.
in that kind of
No,
position.
It's
No, you're not.
completely
Okay.
safe.
Okay.
Are there any other exercise that is easy to do at home, perhaps, besides squatting?
Even though push up, you can do push up during using the wall, and it's
Okay.
safe.
Right.
Pregnant women, postnatal women have to perform push up. Why? Because they need their chest muscle to open, so you are not hunch your back
Right, there you
during pregnancy or during the breastfeeding moment.
Right, okay.
It's good that you're learning all this because
Yeah.
I believe that the role of partners or the significant others are so important
Yeah, I think
to help, women get through pregnancy with exercise. Do you believe in the same thing? I mean, the role of the partner?
Of course. You see, when the partners feel too much afraid while the women or the mother actually in a good health, the husband will ask to the wife, no, you don't exercise. It will be
That would be the easiest thing to do
harmful.
for us
Yeah.
husbands, right?
Yes.
Exactly.
Of course, we need support from our partners to help the mothers being active.
Yeah, exactly. That's again for us, the husbands. It's going to be easy for us to say, "Don't do it," or "You've done enough. Let's just take a break." Of course, but again, with the very watchful supervision of coaches like yourself, it's going to be better, for them to do that. Now, I think what I want to know is that is there any certain period during the pregnancy or maybe after when they start exercising? More on the floor exercises or not floor exercises? Is there any signs or anything that you keeping an eye for when you're giving exercises to the pregnant women?
During pregnant, when it goes to prenatal training, we can mix the training from floor to standing to all four position, even any kind of position in trainings will help the mothers, not only the mothers, but also help the baby in optimal position.
Ah, okay.
What's the optimal position
Optimal
before
position is-
giving birth?
Okay,
Before birth.
optimal position is not limited to head down, it's not enough.
Okay.
But the back of the baby has to be in front of the abs like this,
Like that.
left, right, or in the middle.
Okay.
What will happen if the face is facing front?
Okay, good question. When the baby position like this, and then the baby cannot birth vaginally, or even if they can, and then it will be painful for the mothers. Very painful and long delivery,
So painful for the mother, not for the baby.
not for the baby.
Oh wow. Is there any way to correct that position in case?
Yes, many position during exercise can help the baby move to optimal position.
Right.
See, if you want,
Especially in late pregnancy,
right?
we will suggest pregnant ladies to standing in upright position, so the baby will goes down and
Okay.
you will have an easier labor and delivery.
Nice. Okay, if you want to know more about what exercise or what position can help your baby move towards the optimal position, you can contact Coach Ani. Where can we find you,
Yes.
Coach?
Find me in Dara Studio or Instagram @bersamadara.
@bersama
@bersama
Dara.
Dara.
Take note. Wow, we learned a lot
Oh
today.
my goodness, this is a good session. Thank you, Coach.
Thank you so much.
Yes, thanks for the props. Thanks for the insight, the breathing especially too. I think that's going to be helpful also, not just for the pregnant women, just female, but I think males too. when you start
Exactly.
And the
exercising
Kegel
just in general.
exercise?
Noted.
You should try that.
All right. Thank you so much, Coach
Thank you, Coach Ani.
Thank
Thank you
you
for
so
coming in.
much.
All right, guys, that was Coach Ani. We talk about exercising during pregnancy, after pregnancy. I hope that you guys caught everything there. But if not, again,
Bersama Dara.
Bersama Dara is where you can find more information on that. All right, guys, we're gonna take a quick break. Whoops, I lose my balance there. See the stories will continue after the break. Stay with us.
Let's do